Hi, my name is Victoria Sanders, and I'm 100% disabled for PTSD because of a rape I suffered while on active duty. My issues are sort of personal, but I think that it can be VA-wide that this is occurring. The first issue I'd like to bring to your attention is a bill that I received from the San Francisco VA dated June 7, 2014. I contacted the billing office on June 12th, where I spoke to a man named Andy. The bill was not itemized with the exception of the interest fees. Andy told me that the bill was for services given to me by the San Francisco VA prior to my claim effective date of June 2004. I then received a letter dated June 13th stating that the money is now scheduled to be taken out of my monthly compensation check on September 1st. I asked Andy when the last time the VA billed me for this. He said the date was May 13th, 2005. The San Francisco VA has had my home mailing address and phone number continuously since 2004, and I know this because they mailed me an appointment for my C&P in September of 2006 at my home address. I had Blue Cross coverage in 2004 that I thought had covered these services since the VA stopped billing me after May 2005. I cannot go back to Blue Cross and ask them to pay this bill at this late date. Also, when I received my back pay for disability claim in 2006, they withheld money, and I was never given an accounting of what that was for, and I tried to find out. I am certain that it costs the VA more to research and process this bill for $252.44 than they will collect. I feel this is in retaliation for problem number 2. On July 19, 2013, I testified before the House Veteran Affairs Committee in Washington, D.C. about the care of MST patients from the VA. I only had my personal experience to share, and the only way I as a retired nurse could do, lined out by date, doctor, and what happened. My reward for being honest was on August 8, 2013, to be hand-delivered a letter during an appointment with my primary care doctor by a policeman, an administrator, and a psychologist labeling me a disruptive patient. This was less than 3 weeks after I testified before Congress about the care I received at this VA. I understand the needs to keep staff safe. When I was a nurse, I worked in very dangerous conditions while caring for death row inmates at Marin General Hospital. I have read the criteria that is for labeling a disruptive patient. There is very little evidence that this VA had to put a red flag on my chart. I have a packet for you, and in there is a short article about the way the VA red flags patients. There is no way to fight this label. The fact is, I would never threaten anyone. I might get impatient when it takes 5 calls to get a medication refilled. When I felt the treatment was not right, I never failed to tell the caregiver and document it. I never received trauma-informed care. All of that formed the basis of my written testimony. I asked a senator to look into the billing problem. I got a letter back saying they'd get back to me in 6 to 8 weeks. When I got the disruptive patient letter, I asked my congressman to look into it, and he said to check into how the VA had the chutzpah to call me disruptive 3 weeks after my testimony, and I was told the VA followed the rules. Rules that seemed to be causing harm, not just for me, but for many others. I am disappointed the same Congress that invited me to speak about my care did not stand behind me. To be labeled disruptive just because I seek quality health care for a service-connected injury is unfair. There is no due process, no appeal. The committee makes the ruling, and that is the end of it. In the middle of the VA being investigated, the best they can do for me is send me a 10-year-old bill that, if handled correctly, would have been paid by insurance. It feels like harassment. I have a packet that I'd like to give to you. Thank you.
Hi, my name is Teresa Dyer, and I'm a Korean veteran. Let me introduce myself. I'm a transplant from Minnesota, but my 4 brothers all spent wartime in Leyte Island, on the Normandy beachhead on Leyte Island, and the Salerno beachhead, and 3 came home at the Purple Heart. My brother on Leyte Island lost his sight. So I'm very concerned about when veterans lose their sight in Palo Alto due to the wrong drops given for glaucoma, okay? So anyway, my husband was a 20-year man. I was in the Korean War. I met him, we married, came out here, went to work for United Airlines. My son also spent time in the service. I'm going to read you a letter because none of us women were given our rights and told us what our benefits were when we got out. So lo and behold, I got a divorce after 36 years, and that was regarding a fraud case in San Mateo County, and they don't respect women either. But that's another story. So anyway, in 2003, I applied for medical hearing, and I was happy to get it, and I've been happy for some time. However, I did have knee surgery here a few years ago, and although the surgery was successful, the aftercare was for the pits. And it was the pits that I wrote a letter to the editor, which you're going to get a copy of, but I thought this audience could use a little humor now, so I'm going to read it. In the last 2 weeks, editions of the Pacifica Tribune, Tom Jackson had 2 cartoons of patients being in the hospital, and since I was a recent patient undergoing knee replacement, I thought maybe he could draw a few more and use my captions. How about this? A patient goes into surgery, comes out with a rope burned around her ankle. I never knew a hospital could turn into a rodeo. Next patient is leaking from all faucets. Nurse's aide comes in and says, "I'm sorry," and walks away. Next day, however, a little weak. Oops, she needs 2 blood transfusions. How about the Vampire Diaries? Then a CAT scan and an x-ray. Well, let me tell you, I just wanted to go home. But they decided with the good care they gave me, I was ready to go to a local rehab. But I just wanted to go home. So what instructions did my doctor give? What doctor? What instructions? Can I have a pain pill? Oh, I don't think the pharmacy delivers at 11:30 p.m. You have to wait until morning. Can I have a hot pad or cold pad? Why not? I got both. Next day, the doctor of the rehab came in, never looked at my citizen, and said he was going on vacation for 2 weeks. I said, I'll be out of here by then. Lots of luck. They made me stay the whole 20 days at Medicare paid, and before they brought the forms 48 hours before I could be released. Now it's been 2 weeks, and my stitches are still in. I had an appointment on July 1st, but they told me it was the 6th, because if I left, I knew I was not coming back. So I had to raise holy heck for them to take the stitches out. I was waiting for the nurse to come, and all the while she could have given another nurse permission, and then my doctor ordered health home care. The marketing agent came out and led me to believe he was going to be my therapist. When no one came for 2 days, I called and told him to forget it, and don't dare build Medicare. You know what really pulled me through were the 2 nice ministers from St. Peter Church that brought me the host and daily rosary. I said, and my Vega Sigma Phi sororities who brought me real food. So may I suggest, be sure you have an advocate. Our congressman is now looking into Medicare fraud. Be sure and let her know. By the way, they withheld my pain medication when I left, so I got on the phone and quickly brought them over. 30 Vicodin and other pain pills. I paid for them, Medicare paid for them. By all means, stay healthy and out of the hospitals. With Obamacare, you can expect worse, unless someone else is looking. Thank you.
Hi, Congresswoman Jackie Speier. It's a privilege to speak with you. I have a couple of issues. I joined the service back in '73, and I was in till '74, only a year. But because I broke my thumb in basic training, and they had to operate and all that, and take some bone from here and put it there. But I was a CQ runner for pretty much of the time that I was there. And what became of the CQ runner was I was up with a drill sergeant, drill instructor, during this time at night, and he would have me go out to his car and get some, some marijuana. He just grabbed the grocery bag. I'd go out and I'd grab the bag, I'd bring it in, and he's got his little party with his girlfriend. And then the other drill instructor asked if I would sell some weed to the trainees. So At this point, you know, I'm starting to lose a little faith in
The system.
the
So, sir,
system.
do you have a question about your health care?
Yes, I do.
All right.
Yeah, it leads into that. But because I've lost faith in it, I haven't had VA medical for quite a while. And now I have cirrhosis of the liver, and I'm trying my darndest to get on to the liver list to save my life. And because they told me, you know, the rules and this is what you can do, what you can't do, and while you're waiting, no alcohol, no drugs, none of that stuff, and I was okay with that. And so I got on supplements for about 6 months and came back to the doctor, and she goes, you're the best, I mean, you look better than you've ever looked. And then I proceeded to tell her, well, that's because I'm on, I took some supplements, and she goes, well, we're going to have to take you off the list. So I got taken off the list. And then...
These are vitamin supplements?
Yes. Yeah, I was taken off the list because I was not supposed to. And it didn't, she never explained. Okay, so I got to wait another 6 months, but I got to wait like 3 months. I'm losing track because I don't have a memory right now.
Sir, maybe what we can do, Natalie, maybe you can, Natalie, if you could stand for a minute. If you can maybe speak to Natalie afterwards, we could research this for you and try to help see what we can do and just make it all clear so that you get what you need.
Yeah, okay.
Thank you.
Thank you very much.
Can you hear me?
Yes.
Director, Congresswoman, thank you very much for coming. Rather than have a question, I have 2 statements. There are 2 separate issues, I believe, with the VA, and I'm trying to speak as for all the veterans. I'm a former Navy lieutenant. One is the appointment intervals for existing patients, understaffed. Very long intervals that we have to wait between appointments. 5 months for an ortho appointment. Then another 2 months because the doctor's only in 1 day a month from ortho. One problem. Number 2, subcontracting out to independent medical organizations in Los Angeles for reassessing disabilities using non-VA doctors and advisors. This is where somebody may have a 10% disability and their VA representative says, we're putting you in for 30, or it doesn't matter the percentage. This is not done by the VA. It's done by an outfit out of Los Angeles, subcontracted. The doctors that are here and the advisors that are here are not VA doctors. So you're subject to a whole different type of a reassessment and an evaluation that's not done by the VA. So I just wanted to bring that to your attention in case you weren't aware of it. Thank you.
All right, so to his first question, ortho consults only once a month?
So we have Dr. Kim here, who's our chief of surgery, and he's been making a lot of efforts, I believe, to try to improve access, so maybe he can share with us some of the things that they're doing.
Sure, happy to do that. What, may I ask, we're not supposed to talk about specifics, but there's orthopedic clinic basically 3 days a week. My guess, without going into specifics of the medical condition, is that this patient needed to see a specialist in a very specific area who's only going to be here once a month. So that's my guess. We have some specialists, like foot and ankle specialists, who deal with complex problems, who are here just once a month because there aren't patients to see every single month. So then we have to actually bring in these specialists from the outside as part-time physicians. So that can happen.
This is just a regular orthopedic procedure. This is a sore foot.
Right. Foot and ankle
So
is...
it's not like a special
Well, foot and ankle, to respond to that, foot and ankle is actually a subspecialty area within orthopedic surgery, and we only, our orthopedic foot and ankle specialists is actually only one.
But Dr. Kim, if that's the case, then is knees a specialty and is
Knees especially,
arm a
hips
specialty?
yeah, they're all, but some specialties are so common that we're staffed to see those particular patients all the time. And there's some specialty areas where there aren't that many patients, so that specialist is only here once a week, once a month or twice a month. So that can happen for certain subspecialty areas where we don't have a full-time specialist in that area, but we make use of people who are willing to come and help take care of veterans once a month or twice a month out of their private practice. So that would be one of the situations where we have specialists only on certain particular days. And one of the ways we're addressing that problem is we know that more and more veterans need foot and ankle specialty care. So starting this October, we will actually have a foot and ankle specialist who is here every single week, because we recognize that was one of the areas where we couldn't provide the care we needed to. And so that's how we're going to address that.
So doctor, one of my concerns is, and based on the town hall we had in Palo Alto, a lot of questions, a lot of complaints about orthopedic conditions. And since the baby boomers, who were all part of the Vietnam War and post, are growing older and are now in the system, I would think that the orthopedic demands would be greater on the system, and it would make sense for us to look at having dedicated people in-house versus farming it out to other hospitals to provide that service.
Well, that's definitely true, and the demographics, not just within the VA population, but nationally, there's an explosion of need for orthopedic care. And it's really a question of the mix of patients that we serve in the veteran population, and we know what that mix is evolving over time as waves from different peaks and valleys of people who served come through our system. When we identify those needs, for instance, the foot and ankle, we try to fill those positions as soon as we can. And it often depends on finding the right person who we can recruit to come and take care of the veterans at the intervals that we need them. So foot and ankle, for example, was identified about 18 months ago as an area that we really needed to beef up. And part of that was because one of our providers actually left the VA. He wanted to continue to take care of vets, but the financial pressures just forced him out. And oftentimes to refill those positions, it does take much longer than we want. And in this case, it took essentially 18 months to find the person who we could bring on board.
18 months?
18 months, because all of our positions are also tied to UCSF, and the faculty recruitment cycles follow years of training. So they tend to come as a group at the end of the academic year, become available for hiring, and then if you miss that cycle, it's usually another 12 months before you can actually start to recruit those individuals again. So this is one of the challenges we face, but we are picking off the individual specialties that our veterans need. So foot and ankle, definitely. We had a wave of people needing shoulder surgery, so we hired shoulder people. So it's a moving target, and we always try to bring in the specialists, extremely high quality specialists in those areas that our patients need. But the foot and ankle, I'm not surprised. That was going to be my guess, because that was an area that we have been targeting.
How about vacancies that you have among physicians right now? What's your vacancy rate?
Actually very low. So we're very fortunate within our systems that when we have vacancies, we're usually able to fill them with very high quality people because of our relationship with UCSF.
I see. Okay.
If we didn't have that, it's really, really difficult, and I think that's a challenge faced by some of our associated, the other VAs within our network, because the ones that are not affiliated with academic institutions have a much more difficult recruitment problem, but we fortunately here are able to fill our positions.
Thank you.
I might add that the salaries in the private sector for orthopedic surgeons are very high, and our salaries are not.
So I actually asked the Inspector General about that, and he informed me that having wage adjustments for high-cost areas is something that can be accommodated and can be done by the Secretary of the VA authorizing it. So that was news to me, but I presume you knew that and can make those kinds of requests. And if you're not being successful in making those requests, call me so that I can make the request to the secretary.
Yeah, I think the delta between these salaries is so high that even those modifications, unfortunately, will not attract.
Well, why don't you send me some information on that?
Absolutely.
All right,
Thank you.
thank you. Next.
Hi, my name is Paul Martell, and I want to thank Congresswoman Jackie Speier for inviting my father, Donald. He's a World War II veteran, 89 years old, Purple Heart. I'm having a birthday tomorrow, remind you, but I'll get on quick with my question, and it is specifically addressed to you in Congress. My father and I had a discussion last night about veterans care, and this is the long view. When he came out of World War II, veterans care was so great. From employers to everybody, institutions, academia, the Congress, President, all supported the veterans coming out, and it helped the country. Now, after World War II ended, the veterans care and Congress and American public started losing interest, and we had other important things to focus on. Now, how can we, when you have this, that we're focusing on it now, that the money will still be 10 years available to keep caring for these people when other things will be occurring? And I can assure you that the Congress people will not be having meetings and stuff around the veterans, because that's the long view. And the VA in Palo Alto had a very bad reputation. However, it's improved greatly. But my only concern of Congress and, say, the American public, how can we suggest to the Congress of what bills to be a long-term payment, so when new administrations come in that may not be as friendly to veterans as others, that the money doesn't get cut off? Is there any bills that can be not short-term but long-term, so those veterans will not be forgotten when time elapses? Thank you.
You're welcome. To answer that question, I would suggest to you that once we provide the kind of uptick in terms of personnel, physician and nurse staffing, we staff up to a level that would really meet the needs of veterans in this country. I think it's very, very unusual to have veteran services cut back. We have spent an extraordinary amount of money in just the last 3 years on veteran services as it relates to disability, because there has been a huge backlog of cases just here in Oakland area, one of the worst in the country. We had a 36,000 case backlog. So money has been appropriated specifically for that purpose to fix that. And we haven't fixed it yet, but the money is flowing. So you don't see veteran services diminished once they are.
So we don't have to worry about 5 or 10 years when new people come into office that the money to continue that level of service won't be cut off the funnel to another one. That would be.
No, I don't believe that would happen.